We're so happy that you're here. We're happy to have you.
The main goal of this exercise today is to disseminate the findings of a research study. This research is part of a project called the Digital Health and Rights Project.
And so today we're here to talk about what connection really costs, especially when it comes to our rights. The right to privacy is an important one. The right to access accurate health information is important, and also the right to be treated with dignity online and offline, because that is what we are going to explore. So this meeting is about more than just the research that was done and the findings. It's about me, it's about you, it's about your experiences and those who are not in this room, your voices and your realities.
We had Ministry of ICT represented. We had so many CSOs, we had CBOs, we had consultants who have been helping with the project. We have some of the mobilizers who helped us even mobilize the focus group discussion participants and even the KIA participants. And we also had legal experts and consultants. And we even had tech developers who were also very keen and interested to hear what DHRP has been about.
And we cannot look at solutions in isolations or in silos, and we cannot develop solutions without having the key stakeholders.
As a member of the KCAT, we were able to support the research, be able to guide the principles within the research to ensure that the target audience, those are the young people that I work with, are able to participate meaningfully within the research from the beginning to the end of the research.
As a young person, I remember growing up as a teenager, and I didn't understand what period was, and I didn't have the confidence to go talk about it with my mother. If I was a teenager today, I would be so happy because I can just go online and get all the information that I need to know about period and period preparedness and what I need to know about tracking my period, information that otherwise was not accessible for us young people.
In our health system where we stay here in Kenya, digital health provides an opportunity for young people to access quick support, private. It's not that young people Google things because they want to. It's because there's a lot of time that will be wasted navigating a complicated health system that at the end of the day will not be responsive.
This study basically has been what we are calling a participatory action research. And this basically means that the communities of interest are actively involved in the development, the design of the research, because in the end, who will be the consumers of the study? The communities themselves.
And when I was reading through it, one thing that kept coming to my mind is this key messaging we hear about in the Sustainable Development Goals, that we shouldn't leave anyone behind. And one of the things that just kept ringing in my head is how do we make sure that we are reaching the farthest fast?
So from the findings, we will be able to create awareness. We are able also, young people are able to understand that there's a need for digital literacy, that there's a need for us to seek information, for us also to take in, to capacity build ourselves concerning digital skills, and also how to protect ourselves, privacy, confidentiality, even when we're creating messages, when we're creating our own content, how can we be able to protect ourselves? How can we be able to protect even our devices from surveillance, such things?
Technology can transform every sector, health notwithstanding.
This is the first time that I have actually narrowed down the lens to not only look at digital rights as a whole, but to specifically investigate and look at how young people intersect with their health rights, how they navigate the challenges that come in accessing their right to health, specifically online.
I would like to encompass all the recommendations in one. Policies. We need policies that actually work. We need laws that actually work. I know the Digital Health Act has been rolled out again to start implementation, but being able to be in rooms with the guys in charge, like the Digital Health Agency, or from MOH, or from even the Ministry of ICT and Digital Economy, I think it would be important for us to be able to focus on what we can create, what change we can create from a national perspective. So for me, the the most important key next step would be to find and work with government agencies that are responsible as the duty bearers and show them that, listen, we did our research, this is what the communities are saying, and this is what we're even recommending. How can we move forward with that?
We need to have unique interventions with regards to how we create a safer and more inclusive digital health space for these different interest groups.
We need to also ensure similar rights we are enjoying offline are also protected online. And we can only do that by meaningfully engaging in shaping the governance, the policies, the laws. And for us to be able to do that, we need research.